We have a significant youth crisis in this state. We have had for a number of years.
The mental health situation in Utah is interesting. I think we have some challenges here that other places don't have.
The suicide rate in Utah is number 5 in the country per capita. Some of the research here is starting to look at altitude. There's a correlation between high degrees of suicide in high altitude areas. And this is a pretty high altitude state. I think even in Salt Lake, we're 5,600 feet above sea level.
We recognized that we just had a real need for mental health services directed towards youth, children, adolescents.
Really doing that preventive upfront stuff, identifying it with kids and trying to get them the help they need, the kids and the families. It's critical.
The University of Utah Neuropsychiatric Institute, or UNI for short, is a freestanding psychiatric hospital that is owned and operated by the University of Utah. So it's one of the few freestanding academic psychiatric hospitals. We have about 160 beds.
Now we have probably about 44, 45 child psychiatrists. About half of them are triple boarded, so they're boarded as pediatricians, child, and adult psychiatrists.
Primary care physicians, both in the rural but also just like the local areas, have a huge demand for their mental health treatment that they have for the patients that they're seeing. And they don't often have the training or the time in their clinic days to be able to address patients who come in with depression or anxiety that need treatment. Because of this, a few colleagues of mine and myself created the GATE program, which stands for Giving Access to Everyone. Basically, it is a formalized peer-to-peer consultation service. I call the primary care doctor up, and with their sort of take on what they saw in the patient and their concerns, and with what the patients have told me, I can give them some really, I think, high-quality guidance as far as diagnosis or next steps to do for care.
There's different situations for different kids. But certainly what we tend to see a lot of is that there's gaps in mental health care everywhere. Particularly the gaps exist between, basic outpatient care where you might see a therapist once or twice a week and a psychiatrist once a month or so, and inpatient care, which is very intensive, but in most places tends to be in short supply as well as very brief. And in seeing that situation, some of the child and adolescent psychiatrists here at the University of Utah Neuropsychiatric Institute came up with the comprehensive assessment and treatment program here. It's a 4 to 6 week stay in an inpatient setting, but within a program that is designed to last longer than those average stays that are less than a week. With 4 to 6 weeks, the treatment team can work together with an adequate time frame and adequate resources to actually unravel some of the confusion that may pile up for these kids.
We've worked collaboratively with the state on a couple of pretty unique programs here. We have an app, a phone app called Safe UT, which we helped develop here.
Safe UT mobile app was designed for crisis intervention and school safety.
And it's essentially an app on your phone where you can text and chat with someone if you're feeling down or feeling depressed or suicidal, but also if you're feeling bullied or you think there's an unsafe situation, there's a tip line. And the app is staffed by licensed clinical social workers.
Since its inception, we've taken over 33,000 live chats and over 18,000 tips, school safety tips.
Here at UNI, we kind of have an official motto, I believe, which is just do the right thing for the patient. And it's been shortened lately, just do the right thing.
We've always talked about compassionate care without compromise. That's what we've tried to do from the beginning. We'll continue to look for opportunities to do that and create more access for families and adolescent and children.